Hello and welcome. I'm Melissa Kolb, chiropractor and chief developer of the MKR chiropractic recruiting process. If you're viewing this video, you probably fall into one of two different categories. You could be a chiropractic student with graduation on the horizon, or you could be an existing chiropractic associate and you're seeking to maybe transition into a different level of chiropractic employment. The concept behind these videos is to help you really understand some of the big questions that face students as well as current associates. When I go in and speak with students, maybe T7 through T10, I always leave time at the end for questions. And I find that I get repeated questions over and over for the last couple years. So I've taken some of those top questions and we're going to tackle these questions in the next few video opportunities. The first question I tend to get is, I don't know how I want to practice when I get done with school. I don't know what kind of office I want to be in. I don't know what's out there. The best thing you can do is to really understand what kind of practices are out there. I've broken them down into 3 different categories, and we'll go over those in just a minute. Let me share with you a brief story. A couple of months ago, I had the opportunity to speak with a T10. She was the valedictorian of her graduating class, and I asked her where she would be practicing upon graduation. She indicated that she didn't know. She really didn't know how she wanted to practice or what the opportunities might be available out there. I don't want to see that happen to any student upon graduation. That's why I feel it's so important that you understand what type of practices are out there. And while there may be just as many types of practices as there are different types of chiropractic techniques, I've attempted to break them down into 3 different categories. The first type of practice would be your insurance-based model. This tends to be a symptom or injury type focused practice, usually using functional outcomes and built on forms that the patient would fill out to measure their progress. There's generally a treatment plan, but those parameters will tend to be set by the health plan that the patient is insured by. Care plans tend to be very short. There will tend to be use of diagnostics, x-rays, some different types of practices may even use lab work. There's also maybe some rehab, exercise education that will go into the care plan, and there's generally the use of maybe an electronic health record system. That is the insurance-based practice, and practice members will tend to be in the practice for a very short time frame. The next type of practice, and on the opposite end of the spectrum, would be our subluxation-based practice. This would not be focused on symptoms. It would be focused on the removal of the chiropractic subluxation and focused on proper neurologic function so that the individual is able to live a long, happy, healthy life. They're generally very structured care plans. Most of the individuals in the practice are going to be self-paying for their care because a subluxation-based practice does not generally utilize any type of health benefits or health insurance benefits. The policies and procedures in the practice will be very structured. You'll have sometimes open adjusting rooms or maybe even cubicle type adjusting rooms where the walls would maybe be shoulder height. There's a lot of chiropractic education that it's going to go into the subluxation-based practice. There generally would not be any use of modalities, physical therapy modalities. There generally isn't nutrition or any type of exercise education or rehab that would go into this practice either. The third and final type of practice that we're going to talk about today is what has come to be known as the hybrid or the wellness-based practice. And this would be a practice that will maybe utilize some insurance benefits for the acute care portion of an individual's care plan. There tends to be a high level of chiropractic education as that individual is slowly moved to an asymptomatic or wellness-based type of care. At that point, they would be self-paying for their care. Generally, very well processed and procedured practice. They're very structured care plans, And there may also be use of diagnostics in this practice, X-ray, they might use an Insight substation, nerve scan type of system. There also tends to be quite a bit of lifestyle education. Generally, nutritional products will be utilized in the office. There may be some exercise, rehab education that goes into the care plan as well. This sums up the general 3 different types of chiropractic practices. But then we still have our question, how do I know how I want to practice? The best thing you can do is to get out of your classroom. Visit with doctors that own their own practices and spend time in these 3 different types of areas. Feel what resonates with you. Talk to their practice members. See how they practice. Spend time with the doctor. Visit with their front desk staff. You may find that what you think you want to do and what actually feels good for you is completely on the opposite side of the spectrum. And I would encourage you to also keep a very open mind. The way we think we want to be, or the way we are when we graduate, is sometimes entirely different than how we are 5 and 20 years down the road. This is what I always enjoy when I talk with providers that have been out for that 5 and 20-year time span. They may have been a Gonstead or motion palpation person coming out of school and they put themselves in this tiny box. But 5 years out, they figured that, boy, I've got 10 different techniques I can use now and I'm able to serve a lot more people. The one thing you need to remember is that regardless of what type of practice you move into, the goal is always the same. It's the goal of the doctor, as well as all the people supporting that office, to provide quality care to the patient, to relieve their suffering, and help them live a better, healthier life. I so much appreciate you tuning in for this short video. Next time, we're going to tackle the second question I get, and that is going to be, now that I know what kind of practice I want to be in, am I going to associate or do I want to be a private contractor? Tune in next time, and until then, blessings for a wonderful day. Hello and welcome back. I'm Melissa Kolb, chiropractor and chief developer of the MKR chiropractic recruiting process. In our last video, we talked about the difference between the 3 different types of practices that are out there. Today, we are going to discuss the second most common question I get from those T7 to T10 students that I interact with when I volunteer my services over at the chiropractic school in my location. The second most common question I get is, I don't know if I want to be an associate or a private contractor, and I don't really know what those 2 words mean. Before I get into that, let me share a short story with you. This is one that just happened last month. I had 3 T10 students contact me about the exact same employment opportunity that was listed on the classified section of a school website, and I know that you have consulted your school websites as well. The advertisement went something like this: chiropractor seeks associate to come into the office, treat my patients while I need to be out of the office for a couple months due to a health issue. Upon coming back into the office, I'll need you to grow your own practice, but I also want you to do a bunch of marketing for the practice. After a little bit deeper investigation, a few more questions, and a few phone calls, what I learned is that this individual was seeing about 60 patients a week, patient visits that is, and they were going to be out of the office for a health issue for a couple months. What they truly were looking for, in my perception, is they wanted a relief doctor to come in and treat their practice members while they were going to be out of the office. And they were then looking for maybe a private contractor relationship to come in and share overhead and grow their own practice. Because at 60 patient visits a week, I've got to tell you, that is not going to be a practice that can also support an associate. So let's talk about those 2 different words and what exactly they might mean. In my personal experience from working with individuals seeking employment as well as private practitioners hiring associates, What I see working in a true high-quality associate relationship is this model. The doctor would probably be operating what I would call a waitlist practice. He or she might be working 5 to 6 days a week, and their practice is full. They only see new patients if they're on a waiting list, and the next time they have an opportunity for a new patient appointment time, they're going to choose and pull from that list. In some respects, they might be losing some market share and some business because some people truly don't want to wait. And then they're seeking to find an individual, like a T10 or a new graduate, that is going to come into the practice and be able to work on that waiting list and see those new patients within a day or a couple days. That doctor might want to scale back to working 4.5 days a week, or maybe take a long vacation with their family. After that associate is appropriately trained, that associate would then be seeing some practice members that might have been in the practice a while, so that doctor can have a little more flexibility in his schedule. There may also be a new patient rotation. That doctor that owns his practice might want to see 1 new patient a week, and anybody else that calls is passed on to this new associate. There generally tends to be some type of base pay along with a bonus opportunity. Bonuses can be based on anything from amount of collections on a monthly basis to new patients brought into the practice, or maybe even care plan acceptance. And finally, there are always very clear benchmarks and expectations between the associate and the doctor that owns the practice as to how we get to the next level of opportunity and what my expectations might be of the associate so that we can have a long, healthy relationship with one another. The private contractor relationship is completely different in that when you're a private contractor, you are your own IRS entity. You might work under a social security number or maybe even an employee identification number. At this point, you may own a chiropractic table and some light office supplies, maybe letterhead and a business card. What will happen is you will move into an office where the chiropractor already owns his own office space, possibly, and he owns his business. He may have a staff, he may have diagnostics, and you're basically going to pay that individual to be able to have an opportunity to utilize all that diagnostic equipment, utilize his office, utilize his or her front desk staff. You're probably going to have your own phone line, and you would be responsible for doing your own marketing and truly building your own practice. That doctor, he or she is not going to give you their patients. They have their own practice. He or she wants you to build yours. At the end of the month, you would pay some type of agreed upon flat fee to that doctor for the use of his or her practice facility to have done your operation in throughout the month. Regardless of whatever opportunity you might choose to move into, I highly recommend always having some type of a contract. And that contract is going to be laid out in very specific language to explain how either the associate relationship or the private contractor relationship will be operating. Never, ever, ever move into a business relationship unless you have a contract and you absolutely know what the backout plan is, because even going into this relationship with the best of intentions, things happen. Spouses get jobs in different locations. Parents need opportunities for us to help them as time goes by, and we may have to move eventually. So always have that relationship laid out so that everybody knows what their expectations are, and we can always make sure that those relationships stay healthy. Thanks so much for tuning in, and I hope this helps to explain the associate versus the private contractor relationship. Next time, we're going to be tackling the third most common question that I get, and that is, now that I understand how I think I might want to practice, and I understand that I might want to be an associate and not a private contractor, how do I know that the doctor that's hiring me or the office I'm working in, how do I know that they are a healthy, ethical, respected business in their community? We're going to tackle that question on our third video. Thanks for tuning in and blessings for a great day. Hello and welcome. I'm Melissa, chiropractor and chief developer of the MKR chiropractic recruiting process. In our last two videos, we have tackled the topics of how do I know how I want to practice, how do I want to be engaged in employment, and now we need to talk about how you can evaluate whether a doctor and his office are going to be an appropriate, healthy relationship fit for you. There are probably 20 different categories that you could evaluate on. I've chosen 5. All right? So the first one I feel associates should take a look at would be, has this doctor ever had an associate before? And if he or she has, how long was that associate there? Were they there for 7 years and then moved to a different part of the country? Or has he had 3 associates and they only stay in the practice for 18 months? I would say that the latter is probably a red flag that you're going to want to investigate a little bit further. Second, how long has this doctor had their front desk staff with them? Is front desk staff turning over every year to 2 years? Or has their staff been with him or her for 8 to 10 years? I would say the first one with high turnover, that's an area you'd probably want to steer clear from. Number 3 is the office clean and tidy? And is it up to date? Or do the walls need a good painting? Is there dust on everything? And is the place completely cluttered? Because I've got to tell you, if the place is cluttered and the doctor has stacks of paper on his desk or her desk, this is a doctor that has an issue with what we like to call in the chiropractic profession incomplete cycles. And if you're working for somebody that can't complete their cycles, this is also a recipe for disaster. The fourth one would be, does this doctor offer a clear, concise, printed out 90 to 120 day training process? Do you know exactly where your expectation and benchmarks are going to be on a 30, 60, and 90-day basis? How are you going to be evaluated, and what expectations does the doctor have of you? This is one area I see doctors falling down in all the time. Even if they've never had an associate before, they may not know that a training program is incredibly important. Number 5 is, does this office that you may be looking at and working in, do they have clear policies and procedures, not only for office staff, but do they have procedures and policies for their practice members? Is there a way to do a day 1? Is there a way to do a day 2? This is how we do pass-offs with the front desks.
Okay, start at that part again.
This is how we do a pass-off with the front desk, and here's how we communicate in our office. That's incredibly important. Along with this piece is, does this office use technology? Or are they back in the dark ages and writing everything on paper? Technology is there generally to make things simpler, easier, and it's a way to get more done and offer people a high level of service. For example, do they use maybe email or text messaging to remind their patients of upcoming appointments? As bizarre as I thought this thing was a couple years ago, I can't tell you how much our practice members appreciated having that opportunity to be notified within 2 hours of their appointment that they needed to be somewhere. This covers the 5 top areas I feel are some of the most important when seeking out a doctor and evaluating her office to make sure it's going to be a good fit for you. This ends my top 3 question and answer session for how you may want to evaluate moving into employment relationships. I have a number of other top quality training sessions that I do with my members. And those training sessions can run anywhere from 15 to 20 minutes, and we tackle topics like, how do I evaluate an employment contract? Or how do I take a look at, okay, you can tell I didn't rehearse. And when you went this, you meant talk faster? Or
No, I start that part.
Okay.
Because that's a pretty important part. Right?
Is a very important part.
So just start from where you're comfortable.
Okay.
Going into it again. Like maybe we talk about,
Okay.
or we cover these.
Okay. I offer to my members a number of training videos. These videos run 15 to 20 minutes, and we tackle topics like how to evaluate an employment contract, how do you structure a payment system for when you're an associate, as well as job interview skills. I've got to tell you, just how you walk into a room, the handshake and the eye contact you give somebody, that can make or break an interview right there. Normally, I charge members $2.99 for these training opportunities. And for you, with these special videos, I'm offering a $99 opportunity. By clicking on this link, you will begin to receive videos on a 4-week basis for a 6-month time frame. Please take this opportunity to click on the link, and you'll begin receiving your first video within 24 hours. Thanks so much for taking time with me, and blessings for a great day. For $99, you are going to receive valuable information that could make or break your first employment relationship. You're not getting this information anyplace else. So please accept my invitation. I look forward to having you as an MKR Chiropractic Recruiting Practice member.